The latest figures show that COVID-19 cases in 1 in 5 local authority areas in England have risen in the last week. This on the same day that the government announced that the next phase of vaccinations will be prioritised by age, with 40 to 49-year-olds next in line rather than people in certain vulnerable occupations such as police officers or teachers. The latest 24-hour government figures show a further 345 people are reported to have died with COVID, bringing the official UK total to 122,415. There have been another 8,500 new cases in the UK, and another 485,000 people have received their first vaccine dose yesterday. So now more than 19 million people have received their first jab. Our political correspondent Liz Bates has this report.
The Health Secretary hoped to focus on good news today, the next phase of the vaccine rollout, but instead a stark warning from the Deputy Chief Medical Officer.
Look, this is all going very well, but there are some worry signs that people are relaxing, taking their foot off the brake at exactly the wrong time. Do not wreck this now.
The concern is based on rising case numbers in 1 in 5 local authorities across England over the past week. Different areas have very different rates of infection, it seems. That would suggest that as we come out of national lockdown, we might see the return of local lockdowns. Is that going to happen?
We don't rule out taking local action in an individual area if we see a spike. The goal is for us all to come out together. What I want to stress is that these data show how important it is that we still stick at it.
On a more positive note, there was also the news that the next stage of the vaccine programme will start around mid-April. Once all over 50s and the clinically vulnerable have had offers of jabs, that's when phase 2 of the COVID vaccine rollout will begin. Next in line are the over 40s, and it will continue by age group until everyone over 18 years old has had a vaccine offer. But for those who have been on the COVID front line, like the police, here breaking up an illegal nail bar, disappointment. They hoped the next phase would be prioritised by profession.
To completely ignore them feels like a very deep and damaging betrayal, and certainly the level of anger from my colleagues is palpable. It really is.
And many teachers feel the same, with schools preparing for the return of all students in just over a week.
Staff are anxious about it, and being part of the vaccination programme or being prioritised in the vaccination programme, that would have given a confidence to staff that it is much safer to be back in schools.
But the Health Secretary defended the government strategy.
Trying to come up with a scheme which prioritises one professional group over another would have been complicated to put in place, and wouldn't have done what we asked the JCVI to do, which I think is the right thing, which is to make sure that we minimise the amount of people who die.
And some ethnic minority groups who have higher infection and mortality rates also won't be prioritised. A government study released today does show some improvement from the first wave to the second for the majority of the black and minority ethnic community. But people of Pakistani and Bangladeshi origin are still at much higher risk of catching COVID and dying from it.
Those groups are much more likely to live in overcrowded and multi-generational housing, and yet the government has not provided extra accommodation when it comes to self-isolation. In fact, when you look at it, the government has done very little to address the risk factors for black and ethnic minority groups.
As the numbers of those vaccinated rises, so do expectations that lockdown is nearing the end. But with cases increasing again in some areas, lifting restrictions may not be as close for all of us as we were beginning to hope.
Well, joining me now is Professor Krishnan Bhaskaran, who's Professor of Statistical Epidemiology at the London School and Hospital for Tropical Medicine. Professor, thanks very much for joining us this evening. As we heard there, while the outcomes of COVID-19 appear to have improved for most minority ethnic groups between the first and second wave, it's a really concerning picture, isn't it, for Bangladeshi and Pakistani people?
Yeah, that's right. So this report out today summarises various studies, including some of our work from the Open Safety Collaborative, and it shows real changes from wave 1 to wave 2 in the ethnic discrepancies. So last year, early in the pandemic, it was quite quickly established that several of the ethnic minority groups were having higher risk of dying from COVID. And whereas then in more recent work, looking at later data from the second wave, that pattern's changed quite a lot. And now the black ethnic groups seem to be have more parity with white, whereas for some of those South Asian groups, particularly Bangladeshi and Pakistani, we're seeing still large excesses in risk.
And why is that?
It's difficult to say definitively because the data on the kind of potential factors that might be driving this are not particularly strong. But one clue we can get is that the fact that the patterns have changed so quickly suggests that it is probably more about exposure and infection rather than an underlying biological susceptibility to getting a really bad case of the disease, because that biological kind of factor wouldn't be expected to suddenly change. So we know with some of the South Asian communities that one of the factors that's important is housing and living situation. We have more high occupancy households and more multi-generational households. And in the second wave, one of the kind of features was that the epidemic, the second wave, was really driven by younger people. And so if you have multi-generational households, that's a pathway straight up to the older.
Aren't these figures, sorry to interrupt you, we don't have much time, aren't these figures an argument for pushing these groups up the priority list, though?
I can see that argument. I think JCVI have decided to really stick with the age priority, and age is by far the most important risk factor. And there's an argument for the simplicity of that, which has really helped get the vaccine rollout to succeed. But what's really an issue at the moment is the emerging discrepancies in the uptake of the vaccine. So even with the existing kind of equal priorities just by age, we're seeing much lower uptake of the vaccine in both South Asian and Black communities. And that's going to reverse all the progress that's been made with some of the groups having more equal risk in the second wave.
And very, very briefly, how do we change that?
Well, I think there's two main things. It's really improving access. So that what can we do to make sure these communities have access? Can we have mobile vaccination centres, put the centres in the communities? And secondly, increasing confidence. So you've got to battle against this misinformation that's around about the vaccine. And I think that has to come from people that are trusted within those communities.
Professor Bhaskaran, got to leave it there, but thanks very much for talking to us. Thank you.